The ultrasound you will need must have a linear probe and, in addition to the regular mode, a color flow mode. Every device has its own settings, and you will have to follow the recommendations from the manufacturer of your device. In this case, we will use a frequency of 6 MHz and a PRF of 4000 Hz. As for all transrectal examinations, you will first need to empty the rectum and retract the uterus. Introduce the linear probe and identify the presence of one or more corpus luteum with the normal mode. Here, we will use a uterus ex vivo to demonstrate the manipulations during the Doppler examination. You can see here the interior vagina, the cervix, the body of the uterus, the horns, and the ovaries. On the right ovary, you can see a CL. For the Doppler ultrasound, retract the uterus and do the first ultrasound examination of the ovaries to identify the CL with the normal mode. When you identify the CL, keep the probe in place and start the Doppler mode. Unlike the regular examination, you must stop using the scanning motion. Indeed, a scanning motion will cause artifacts as the Doppler identifies movement. Your movement or the blood's movement have no difference. Consequently, you must keep the probe over the CL and rotate it slightly. You must do this movement slowly to visualize the blood flow. If a CL has no blood flow, as for a D0, repeat the same movement with another angle to ensure you did not miss an important blood vessel. As you know, the corpus luteum is a hypoechoic spherical structure. Once you've identified the CL, you can evaluate the blood flow. When the color flow Doppler mode is on, a yellow square will appear on your screen, and the CL can be classified according to the proportion of the CL where the blood flow can be visualized. In this case, there is no color in the CL, and a score of 0 is given. If color is visualized on 10 to 30% of the CL, a score of 1 is given. If color is visualized on 40 to 60% of the CL, a score of 2 is given. And finally, if color is visualized on more than 60% of the CL, a score of 3 is given. A cow is diagnosed as non-pregnant if there is no CL identified with the ultrasound, or if a score of 0 is given to the CL 21 days post-insemination. Once you've completed the examination, remove the probe and clean it with a soft disinfectant so it's ready for the next cow.